Good morning, everyone. Welcome to today's webinar, organized by a committee that has come together in order to plan for a US-Cuba Normalization International Conference in New York City. Today, we have a webinar titled "The Worldwide Health Crisis Demands Solidarity, Not Sanctions," where we will spend some time together with our honored guest, the Cuban ambassador to Canada, Josefina Vidal, among other speakers, in order to explore how we can build our struggle together against cruel US blockades and sanctions in the time of COVID-19, a time where the United States government is increasing their pressure on the government of Cuba through sanctions and blockades, as well as increasing their pressure against the government of Venezuela, while at the same time creating a disaster situation for poor, working, and oppressed people in the United States, especially when facing COVID-19. Today, we have a panel of Cubans, of activists, of doctors who are going to really show us how Cuba is leading the way in this struggle against COVID-19, and also how we can work together more at this time in order to build a stronger and more united Cuba solidarity and Latin America solidarity movement. So I want to thank you all for joining us. My name is Alison Bodine. I am with Friends of Cuba Against the US Blockade here in Vancouver, Canada, and my co-chair is Brenda Lopez.
Hello, everyone. Good morning.
So Brenda, if you want to introduce yourself and say a few words about what we are doing here today.
Hello, my name is Brenda, and I am here in sunny Los Angeles. I am co-chair with Mark Friedman, who will also be speaking later today, of the LA-US Hands Off Cuba Committee. And we're here today because time and time again, Cuba has shown what true humanitarian aid looks like. And this might be by sending medical missions to different countries after big catastrophes like earthquakes, hurricanes, and even now during COVID-19. All of this with little resources and in inhumane sanctions that the US continuously imposes and refuses to remove. And overall, we can just learn a lot about working together with other countries and nations, much like Cuba has continuously done so.
This webinar has come together, as I said, out of the US-Cuba Normalization Conference, which was originally planned in New York City to take place at the end of March of this year. Due to the COVID-19 pandemic, it's been rescheduled for November 14th and 15th in New York City. But in the interim, we are coming together as Cuba Solidarity activists from the National Network on Cuba and the Canadian Network on Cuba, and other groups and individuals across the US and Canada in order to join in the fight and in the struggle for education around Cuba's leading example in the fight against COVID-19. I encourage people to participate today. You can ask questions. There's a Q&A box at the bottom of your screen. You can also be watching this video live streamed on Facebook and share it with your friends and family, as well as go to the website us-cubanormalization.org to find out more about the conference, watch previous webinars, and donate to future organizing and building a stronger solidarity movement in between the US and Canada for our Cuban brothers and sisters. To start off today, I am very honored to introduce the Cuban ambassador to Canada, Josefina Vidal. Josefina was also in charge of the negotiations between the United States and Cuba towards normalization that began under the Obama administration. And we are very honored to have her here with us today to bring her knowledge and her expertise and to start off the panel. Please welcome me in joining Her Excellency, the Cuban Ambassador to Canada, Josefina Vidal.
Thank you. Can you hear me?
Yes, sounds great.
Yes, hello everyone. I am speaking to you from a cold Ottawa. It's taking a long time to get over the winter here. Thank you so much for the invitation. First of all, I wish that all panelists and those who are watching us today from all over, from Canada, from the US, from the rest of the world, are doing well. I would like to thank the organizers of the webinar in Canada and in the US for this wonderful idea, because it helps keep us together in these difficult and challenging times of the COVID-19 pandemic. Before I begin my brief presentation, I wish to commend the Canadian Network on Cuba and the US National Network on Cuba for the vigorous joint campaign that you decided to launch a week ago, calling for collaboration between Cuba, Canada, and the US in fighting COVID-19 and for the end of the US blockade against Cuba. To you and those who are supporting the campaign, I have to convey our deep gratitude on behalf of Cuba and the Cuban people. I want to mention on this occasion that our embassy last week made arrangements and articles about this campaign were published on in the Cuban press, specifically in Cuba Debate and Prensa Latina. So many people in Cuba already know about this very important campaign. I would also like to take the opportunity to thank friends in Canada, where I am posted representing the Cuban government, for other initiatives that they have launched in recent days. For example, the Canadian Network on Cuba campaign to support Cuba's contribution to the world's fight against COVID-19. There has been open letters and different statements by different organizations in solidarity with Cuba. For example, CCFA Toronto, La Table de Concertación et Solidarité Québec-Cuba, and different associations of Cubans who live in Canada, who have also addressed letters to high-level government officials in this country, asking them to raise their voices against the US blockade and work for its lifting. Every nation in the world is facing an unprecedented threat to its survival because of the COVID-19 pandemic. As the title of this webinar rightly says, this worldwide health crisis demands solidarity and not sanctions. My colleague, Ambassador Jose Cabañas, said last week at the first webinar of this kind that was organized that Cuba is facing now two pandemics at the same time, the COVID-19 and the US blockade. And he's totally right. I would just add that the latter, that is the blockade, could be considered even worse than the first one, the COVID-19, because it has lasted for almost 60 years now, and it has had a very negative impact on every single Cuban and on the whole functioning of the country and our relations with the outside world. As you are very well aware, the economic, financial, and commercial blockade imposed by the US government against Cuba has continued to intensify in a significant way in the last 2 years. Just between January 2019 and March this year, the United States has implemented, can you hear me? Okay. Just between last year and March this year, the United States government has implemented more than 90 measures targeting Cuba's financial transactions, the tourism industry, the energy sector, foreign investment, and medical cooperation programs in other countries. These measures by the United States are unprecedented by their level of aggressiveness and the scope. And they have been, these measures, deliberately aimed at depriving Cuba of sources of revenue to suffocate our economy. These measures have had a significant negative impact on the Cuban economy and have severely damaged the basic living conditions of the Cuban people. Due to the extraterritorial scope of the measures, they also affect Cuba's trade and external economic relations and financial relations with the rest of the world. And they have also been detrimental to the business interests and trade relations of different countries with Cuba, because many countries just fear falling afoul of US legislation. That's why, again, last year, for the 28th consecutive time, the UN General Assembly overwhelmingly adopted the Cuban resolution that demands to put an end to the blockade imposed on Cuba. However, as you well know, the United States government continues ignoring this worldwide demand and has continued to tighten the sanctions against Cuba. The effects of the sanctions are felt even more now when Cuba is fighting COVID-19 pandemic. The blockade has become a major impediment to purchase much needed medicines, equipment, and materials to deal with the pandemic, as well as to receiving and to providing international aid. For example, the blockade makes it impossible for Cuba to buy medical supplies and technologies that have more than 10% of American components. The restrictions imposed by the blockade on banks, on shipping companies, on airlines, to prevent them from having normal operations with Cuba have impeded the arrival of medical supplies and donations to the country. Just recently was worldwide published, it was in the news, that a shipment of medical supplies made of masks, rapid diagnostic kits, and ventilators donated by the Alibaba Foundation of China could not arrive in Cuba because the airline that was contracted to do so refused to transport this important cargo to Cuba, arguing the existence of US sanctions. Fuel shortage is also a problem that affects the operation of and the rapid response capacity of the Cuban health system, because as you know, the US has been putting lots of pressures on shipping companies, insurance companies, and ship owners to prevent them transporting oil to Cuba. Despite all these difficulties that we are confronting now, Cuba, as you know, has responded to requests for collaboration from 20 countries so far, mainly from Latin America and the Caribbean, but also from Europe, Africa, and the Middle East. In just a few weeks, Cuba has dispatched 21 contingents of the well-known Henry Reef Brigade to help these 20 countries in different regions in their fight against COVID-19. This brigade, as some people already know, is highly specialized in providing services in situations of natural disasters and pandemics. And I have to tell you, I would like to take the opportunity to announce to you that more brigades will be deployed to different countries in the near future. And so to the more than 1,000 doctors and nurses who are part of these 21 Henry Reef brigades, you have to add around 28,000 doctors who have been working in 60 countries before the pandemic was declared. So the medical personnel in those countries that have been there before the pandemic will also be helping local health authorities coping with COVID-19. During last week, I have to tell you that several video conferences have been conducted between experts from the Institute of Tropical Medicine in Cuba, with Cuban medical brigades in 7 African countries and 1 Latin American country, to share with them information about specific treatment for patients so that they are ready to provide their services locally wherever they are. We have also shared some medicines produced by Cuba that, according to our practice, have proven effective in the prevention and the therapy against the disease. All these actions have been undertaken without neglecting our duty to protect the Cuban population. The Cuban government has mobilized all its limited resources to provide the necessary care to our people. So far, I think that Cuba has been doing a rather good job building on the strengths of our health system, which, as you know, is based mainly on prevention. At the primary care level, family doctors, nurses, and students of medicine are going door to door to interview Cubans to detect any possible symptom of COVID-19. So we are actively looking for people with COVID and not waiting for people to go to the hospital when they are really sick. As soon as people are suspect of having COVID, or we detect contacts of people who have tested positive, they are all transferred to special health facilities, and they begin receiving treatment right away with several medicaments that the Cuban biotech industry has developed. There is a clinical trial going on now with a group of suspects using a molecule that has been created by the Center of Genetic Engineering and Biotechnology in Havana. And this molecule improves the body innate immune response. So this is a very important clinical trial that is being conducted now and will show results in a matter of time about the effectiveness of this treatment. In the case of people who are tested positive in Cuba, they are immediately hospitalized and treated with a combination of different drugs, including the Cuban interferon alpha-2b recombinant, some antiretrovirals, and other medicaments. And in the case of patients who are in a serious or critical condition, they receive also the Cuban interferon together with monoclonal antibodies that has been developed in Cuba too, and other drugs. And at this stage, there is another clinical trial which is underway in Cuba to scientifically validate the use of plasma with this group of very severely ill people in a critical, patients in a critical condition. As you can see, the Cuban scientific community has joined forces with our healthcare system to help patients with COVID. And in total, 19 medicaments produced by our biotech industry are being used now as part of the protocol to treat patients with COVID, while a vaccine is discovered in the world. I take the opportunity to mention that Cuba is one of the more than 60 countries that the World Health Organization announced the other day that it is doing some research on a vaccine. In summary, our prophylactic and therapeutic approach in Cuba is oriented at containing the spread as much as possible through preventive measures and treating all suspects and all contacts of positive cases from the very beginning to improve their response to the virus. And at the last stage, to treat positive cases with several medicaments to try to prevent their health condition from worsening and becoming seriously or critically ill. So far, I want to share with you, I listened today to the press conference that the head of epidemiology in Cuba every day has for Cuban people. It seems that the treatment and the strategy that we are using is producing some results so far. Also, it has to be improving scientifically, because so far it is helping Cuba to keep a low mortality rate of 3.2%, when you compare it with the global mortality rate, which is almost 6.9% now. The US blockade against Cuba, which, as you know, is the most unfair, severe, and prolonged system of unilateral sanctions ever applied against any country, was never justified. But now, at the times of a pandemic, is less justified when we all have to fight together this major threat that we are facing. As the UN General Assembly has shown consistently, the US blockade against Cuba is illegal, but it's also politically and morally unacceptable. In recent days, I'm sure that you are aware of that, there have been many voices that have been raised condemning the US blockade, from the UN Secretary General to the UN High Commissioner on Human Rights, to the Pope, several foreign governments, non-governmental organizations, among others. They all have been demanding an end to armed conflicts and at the same time, the suspension of unilateral coercive measures, because this is the right thing to do for humanitarian reasons, particularly now in times of a pandemic. The Cuban people and the Cuban government have always been very, very grateful for Canada's valuable traditional support and vote in favor of the Cuban resolution, the one that we present every year at the UN General Assembly, that demands the lifting of the US blockade against Cuba. We also hold great esteem and appreciation for the permanent displays of solidarity towards Cuba by many Canadian friends, many American friends, and friends from all over the world, who over the years have developed strong bonds of friendship with hundreds of thousands of Cubans. In this exceptional situation in which we are living now, which require that we set aside all political differences, that we all work together and collaborate to overcome this big challenge that arises from the current pandemic. I take the opportunity to appreciate your support, and we ask for your support to do everything possible to raise the awareness about the negative impact that this US blockade have on Cuba and its people, and to work together with us to put an end to this a very strict regime of sanctions against Cuba. Today, as it has been the case in the past, and I remember very well, everything that we do together in our common battle to free the Cuban Five, the actions that you might take could be a very important contribution to the worldwide efforts to remove the unjust and illegal US blockade against Cuba. Once again, on behalf of the Cuban government and of the people of Cuba, I would like to reiterate my deep appreciation to you all and to the rest of compañeros from the World Solidarity Movement for your friendship and for your support to Cuba, as well as to convey our sincere wishes that you remain healthy and safe in these challenging and very difficult times. And I want to, just to finish, remind everyone that a day like today, tomorrow, 59 years ago, on the beaches of Playa Girón, in the Bay of Pigs, Cuba defeated a mercenary brigade armed and supported by the United States government. And we are confident that as we did 59 years ago, as we have done many more times after that, we are very much confident that we will resist once again. And with your support, we will overcome this very difficult situation. Thank you, dear friends, for your support. Thank you.
Muchas gracias, Ambassadora Vidal. We're very happy to have you with us today. As a reminder, if people are participating over the phone, you may email your questions to info@us/cubanormalization.org. And all questions will be and answers will be after all our panelists are done talking. So up next, we have the pleasure of having Dr. Christine Knight with us, who is a recent U.S. graduate of Latin American School of Medicine from Havana, class of 2019. A little background on the school. The Latin American School of Medicine is a medical school in Havana, Cuba, that offers free medical scholarships to students from around the world to study medicine in Cuba. This scholarship is also available to students in the U.S. through a program facilitated by IFCO and Pastors for Peace. Dr. Christine Knight.
Hello, everyone. And first of all, I just want to say thank you. It's an honor to be on this panel with everyone here today. And it's an honor to be able to connect over such an important topic, especially at a moment like this. I also want to thank Gail Walker and IFCO, one for inviting me today, but also for their continued work in working with Cuba to offer this medical school scholarships. I want to say a special thank you to the soon-to-be Dr. Samira Adri. She's a sixth year in Cuba right now, who had kind of helped me understand a little more about what's happening in Cuba in the ways that their COVID response has differed from what I participated in terms of the response against dengue, Zika, and chikungunya. Most importantly, I want to thank Cuba and the Cuban people for many things, but especially for their resilience and their continued support of people throughout the world, and for offering these scholarships to myself and to people throughout the world, not really even understanding the change that has for individuals, their families, and their communities. So thank you. So I guess what I'm going to talk about is going to, in many ways, thank you to Ambassador Josefina. It's going to kind of continue from that, but my interest today is to talk to you about the Cuban healthcare infrastructure, and then kind of what they're doing and what lessons we could be learning in this moment of COVID-19. First, I want to say that COVID-19 is kind of just, the way that Cuba is approaching this is kind of a reminder for us all that this is not new for Cuba. They have a healthcare infrastructure that, as Ambassador Josefina explained, is very much based in primary care and prevention. And with that, I would say public health. And so what that means for the response now is that a lot of the infrastructure that they have already established, they've been practicing this for years in terms of putting people at the center of their response. And because of that, like Ambassador Josefina explained, you're seeing these statistics that despite all of their difficulties and their lack of resources, they're seeing quite incredible health statistics coming out, which is actually not exclusive to COVID-19. It exists with a lot of the other health measures that we have, such as infant mortality rate and life expectancy, things that we're seeing Cuba coming out with incredible results in that, despite living under an embargo and despite having to create this healthcare infrastructure with the small resources that are available. And so as mentioned, so what I kind of hope to talk about is what that infrastructure looks like and what lessons we can take from that. So as Ambassador Josefina explained, on that primary level, you have doctors, neighborhood doctors. So it's called Medicina General Integral. So this is like our family medicine doctors who are divided geographically throughout communities. And so what that does is that it essentially creates so that any given geography has a doctor assigned to it. So when we're talking about these moments like this, where we're worried about understanding who is in our communities and who are the most vulnerable, Cuba has already established through comprehensive health analysis that are performed yearly, who are the people that make up the neighborhoods, who are the people that make up the community. And for example, I'm a family doctor within my community of so many hundred people. I have, 20% are over 80 years old, 30% have hypertension, 20% have diabetes, and of that, these are the people that are controlled, these are the people who are uncontrolled. So it's essentially building an infrastructure in which already, if we are going to have anything that happens within that community that could threaten further and create further vulnerabilities, they already have an understanding of who's in that community and who they should be looking out for based on what new crisis we're facing. So for example, when we were working around Zika, we were worried about pregnant women and people for the fear of transmission to children. So it's like that is an example of something that it was already understood where we need to go and who we need to talk to. Now, in this moment, we're talking about COVID-19, and we're worried about vulnerable populations of being those who are elderly or with multiple comorbidities like hypertension, diabetes. Family medicine doctors already have an understanding in their community of who they are, where they live, what resources are available to them to make sure that they are taken care of in the best way possible. So with that being said, this is something that already existed and informs the work that is happening now. So as Ambassador Josefina explained, what's happening now is what we would call in our school classes pesquisaje. So that's like screening, that door-to-door screening. So we were called upon as students, third year through fifth year students. And I know now they've pulled in students from dentistry and physical therapy, all to participate in going from door to door and asking, within a safe infrastructure, so maintaining distance, calling from the balcony, everyone is provided protective equipment, but going door to door and saying, okay, we know who are elderly, we know who are people with hypertension, but we're gonna go and one, make sure that we know who they are in the present moment, and two, we're gonna make sure that there's an education component. We're gonna talk to them about what are the symptoms, what are the things to be looking out for, and then two, there is that screening moment of saying who are the people who have had fevers, who are the people who have had any respiratory symptoms. And so I think what's interesting is that, so from that moment, you kind of get an idea of like what you're working with, but they also have an infrastructure behind that to say, okay, now once we identify people who do have these symptoms, let's say, then those people are linked into the healthcare system and said, here, come with us, we're gonna take you to our policlinico or our clinic, and we're gonna link you into a place, one, to get housing, to get food, to get access to testing, and to say, we're going to test these people and figure out if they test positive or not for COVID. And if they do test positive, we're going to offer them this 14-day quarantine period to let them run the course of that illness under observation to make sure that there are no complications. And then on top of that, to say, here is it's the hard part. And this is something that, personally we're dealing with, or many of us have seen people dealing with. When someone tests positive, what do we do here? It's hard. Like, if we don't live in a multi-bedroom apartment or house with multiple bathrooms, how do we enable spaces to safely take care of those who are ill? And so Cuba has that built into their infrastructure and says you could stay in this hospital for that period of time. We're going to take care of you and monitor you until the end of the course of your illness, and then also out of that quarantine period. And so next, what I want to talk about outside of that screening is the testing, right? Because, in Cuba, we learned many different public health measures. We learned about quarantine, we learned about isolation. These are public health tools, right? And screening, pesquisaje, these are public health tools. But another component is testing. It's like, as proven in our COVID, in this short history we have with COVID-19, it's proven to be a highly effective public health tool that has helped many nations. As we've seen, the nations that are testing more people compared to positive cases are coming out with much better health outcomes. So just as an example, I read an article recently that said Cuba is testing you know, for every 25 tests, they're having one positive case, right? Whereas, you know, countries like Vietnam and Taiwan, who have seen very positive outcomes, are testing 100 people for every one case. And that's compared to, for example, the US, which is testing every 5 people for one positive case. So I think, and this is despite having an active blockade that is making access to these tests more difficult, extremely expensive. But the system is recognizing and trying to balance as best as it can, saying, you know, we know the importance of this and we're going to prioritize this despite having this difficulty in acquiring these tests. And interestingly enough, of those tests that are done, which at this point is nearly 20,000 tests, 40% of the positives are asymptomatic people. So this speaks to the nature of what we're dealing with, right? What we're dealing with is a respiratory virus. This is something that the way that it is transmitted is very much a community acquired illness. And so if we're talking about trying to limit that, understanding who are the asymptomatic carriers becomes important. And that's something that, despite difficulty in resources, Cuba is prioritizing and having positive effects because of that. So I also want to talk about, because especially organizing here, and I specifically am in the US, a lot of the difficulty comes from, okay, let's say that we do build up a door-to-door screening method, or let's say we do find a way to link people into testing or into care. There are so many other factors that come into having such a widespread infectious disease, you know, taking over well, the world, right? But specifically in communities, if we're looking on a micro scale, right? So it's these social services, right? So I think what is important about the way that Cuba takes on these, this screening and this pesquisaje and this way of kind of understanding who is within their community and where they need to focus their energy is that enables them to say, okay, despite this lack of resources and despite not having as much as we would like to offer, with what we have, we are now going to use it as effectively and efficiently as we can, right? So it's saying, so now other measures that Cuba is taking is, as many of us know, is they put on a travel ban of people coming in and out of the country who are not Cuban nationals, or even limiting travel between provinces within the country. And even as of late, suspending public transportation to facilitate you know, this quarantine model. And so the reason that that's important is because it's not like they're taking away transportation from people. They actually, with jobs, offer transportation. So it's taking the resources that they do have and saying, okay, we are going to now offer this to our essential workers, make sure that they safely get to work. They also are increasing access to food for people. So like a lot of the public restaurants are now being repurposed into cooking meals and delivering them to the elderly people in the community. The agriculture system is increasing its production to offer more healthy food options and increase food subsidies for individuals who, one, can't go get their food, or two, currently cannot be working to afford that food. Outside of that, face masks are required by everyone in public. This is something that, again, is a public health measure that is now able to be actually universally implemented. The Cuban internet system is expanding their services, allowing people to connect more through you know, what we're doing now in terms of connecting with information, ideas, but also connecting to loved ones, and mentally what that is to at a time like this that feels somewhat isolating, still enable people to connect and socialize and care for each other emotionally. And so next, I think I wanted to take that into another extremely important component, which is education. Organizing in the US, you know, what's hard is that there is not necessarily a centralization of information. And so many people get exposed to a lot of, sometimes which are genuinely bizarre sources of information around this virus that could end up being pretty harmful in terms of people sometimes offering opinions or things like that that are not necessarily founded in a preventative or a proper treatment method for what is a very serious problem. And although it's hard because we can't see it, right? We can't see a virus. And if you don't have a loved one who is affected by it, you may not know it. But it's a serious issue, and it's an issue that's affecting many people, and especially vulnerable people, which, especially from where I'm at, have infrastructurally been harmed for years. And so those are the vulnerable people. And so by denying it and kind of reproducing a lack of centralized knowledge, it kind of takes us away from the focus, which is helping people and taking care of people and keeping people at the center of why we're even organizing at all. So examples which Ambassador Josefina mentioned is, every day the lead epidemiologist of Cuba makes presentations, goes over the cases that are positive and says, so it's like, imagine if every day we understood, okay, oh, there's a 20-year-old person who tested positive. Oh, there's a 80-year-old, an 80-year-old, an 80-year-old. We then get to understand and say to ourselves, oh, these are younger people are also being affected. Elders are being affected. It helps us understand and frame what information we're receiving and kind of how to, how it actually affects us. Because if you live with your grandma, you're not going to want to go off and do something socially irresponsible because you could take that home and harm your grandma, right? So it's like, it's allowing a way for people to connect to what is happening. Not just that, but there's a television program called Mesa Redonda, which is like the round table, right? It's where, I mean, it has many purposes, but now it's being implemented for scientists, for doctors, for public health workers, for people to talk about it, the international response, to talk about what is effective, what isn't. It's sort of like a debate circle. So it's like a centralized way for people to understand what's happening. And this is all broadcast on the television, which is like a free resource for people to get access to. And so I said a lot of things, but I think what I want to kind of do now is kind of close off by saying that, so these are kind of phenomenal things that, I personally had the gift of being exposed to by studying and living in Cuba, but I think now is the time, we're inside a lot and we have the time for reflection. And I think part of that, what that has brought to me is kind of emphasizing even more the importance of what it is to take this moment and reflect and realize that this is a global problem. The US, I speak for that because that's where I'm organizing and trying to work right now, but in an international way, it's time for us to learn from each other, no matter what our circumstances are. And to realize that if we are centering people at our, centering people as why we are organizing and as our fight, then that's going to change why we are doing things and what we're doing. And so kind of one of the biggest things that I took from Cuba that was not necessarily taught in school or anything like that was Cuba's sense of resilience and Cuba's sense of community, which sadly here, we're finding it's very difficult because we don't have these resources where we say, oh, we'll go door to door and then we'll link into the healthcare infrastructure. We don't have that because, quite frankly, our government doesn't offer that. And Cuba does have that infrastructure, but what I did learn from there, which I hope to implement here, is that sense of community and resilience and saying, okay, maybe it's not our government, but as we link into where we're from, there are a ton of community organizations, many of them represented here, who are doing great work. And so I think it's really time for us to reflect and take these lessons and say to ourselves, how do we use them within our communities and take the resources that we do have and work together at a time that is even more difficult, but if we keep people at the center in the way that Cuba's system does, and if we take the lessons that are really not crazy lessons, it's not hard to learn them, it's just hard to be willing to implement them. But yeah, I think that now's our time. I guess that's our call. That's why everyone is trying to learn from each other right now. And so to end, I just want to say I'm grateful for Cuba for everything that you do, the Cuban people for your resilience and for your lessons. And I hope that we all understand the importance of supporting Cuba in the work that they do, that we call for the end of the blockade so that we can further learn from them, receive the work that they're doing, and, you know, kind of have that exchange finally that I really believe will benefit us all. So thank you to everyone. And thank you.
Thank you, Dr. Christine. Very happy to have you here as well. Up next, we have Mark Friedman, who is my co-chair and for the LA-US Hands-Off Committee, and who has a short announcement on the US-Cuba-Canada Medical Cooperation Campaign. Mark? Mark, we can't hear you.
Sorry.
There you go.
Thank you, Ambassador and Christine, for terrific presentations. And I hope everyone stays on for the other speakers and text your friends to join in this Zoom call, which will go on probably another half an hour. I've been asked to talk about the campaign to expand US-Cuba medical collaboration and ending the blockade. While COVID-19 is ravaging the world, infections and fatalities continue to spiral upward in many cities and countries. Fortunately, in some areas have begun to level off. We rarely hear about the situation in Latin America, Africa, and most Asian nations. Most of these countries lack sufficient medical personnel and services and suffered severe cutbacks, including the US colony of Puerto Rico. Fortunately, internationalist Cuban medical teams have provided necessary services over the past decades in scores of countries. In the US, the most vulnerable communities are suffering under decades of inadequate medical care, hospital closings, and massive medical personnel layoffs, with African Americans and Latinos disproportionately affected. Doctors, nurses, and other healthcare workers are driven to exhaustion and beyond in their valiant efforts to save lives. In many cities, these are doctors trained in Cuba through ILAM. Nurses have been in the forefront of protests for more medical equipment, demanding 6 feet apart, demanding N95 masks, while the hospitals, under CDC direction, skimp on necessary gear and criminally tell them to use inferior equipment. Here in Los Angeles, I was able to attend a demonstration Monday of 50 nurses, members of the National Nurses Union, 150,000 strong, who are organizing nationwide protests. UCLA retaliated by suspending 10 nurses who refused to treat patients without adequate safety equipment. These healthcare for-profit companies care nothing about healthcare workers' lives, but this is the pattern nationwide. We can and should join in these types of protests in a safe manner with physical distancing and masks. This is a receptive audience to our campaign and our Cuba solidarity work. Now is the time for international medical cooperation and solidarity, a time for joint efforts to confront COVID-19, a time to put political differences aside in order to save lives. It is for this reason that we launched a campaign calling for medical collaboration with Cuba to gain access to Cuban medical expertise to assist in fighting COVID-19. Cuban medical missions, the White Coat Brigades, as they are affectionately called, are dispatched almost daily to other countries. These missions reflect Cuba's long history of medical internationalism. Many are part of the Reeve International Medical Brigade against disasters and serious epidemics, which distinguished itself in the 2015 fight against the Ebola epidemic in West Africa. Cuba also offers medicines not available in the United States and Canada, including interferon alpha-2b, which combined with other drugs has proven effective in reducing symptoms, duration, and mortality. It is being widely used in China. It is also a preventative measure to protect healthcare workers from contagion. At least 45 countries have sought it for confronting the pandemic. With this second Zoom call on this subject, we want to further expand our campaign which has already received broad support from prominent Hollywood celebrities, scores of physicians and other medical personnel, scientists, organizations of all different types and individuals. This represents a dramatic increase in support for our campaign for normalized relations with Cuba, ending the blockade, and a halt to regime changes. Cuban medical expertise can and will save lives. It already is. Cuban Foreign Minister Bruno Rodriguez stated, "Humanity faces a common challenge. This pandemic does not respect borders or ideologies. It threatens the lives of all, and it is everyone's responsibility to address it." Specifically, we call for allowing U.S.-Cuba-Canada medical collaboration, ending U.S. economic and travel sanctions against Cuba, including its extraterritorial nature, and the attempts to stop all other countries accepting Cuban medical brigades. Incorporating Cuba's interferon alpha-2b recombinant in clinical trials in the US, Canada, and the World Health Organization trials, of which it is not a part. Expedited US Food and Drug Administration approval for Cuba's interferon alpha-2b. In order to carry out this campaign, we need your financial support, in addition to you signing and distributing our appeal letter, which you will find on the website. We are thinking about broad publicity in the media, possibly local and national newspaper ads, in addition to whatever coverage organizations and individuals can muster in their areas. And we have the International Solidarity Conference that was scheduled for March that has been postponed to November. Hundreds of dollars were spent on printing, which must now be redone. The opportunities we now have affords us the possibilities of this being the largest conference in solidarity with Cuba ever in the US. But we need your help. Even small donations can go a long way. So please go to the USCubaNormalization.org webpage and click on Donate button. Funds are for the conference. Thank you.
Thank you very much, Mark. I will also type into the chat box all the websites that Mark just mentioned. I encourage people to sign on to the letter about US, Cuba, Canada medical cooperation in the time of COVID-19, and to really use it as a way to work in your communities in the struggle against the US blockade, which impacts not only people in Cuba, but also people in the United States who can't have access to the medical methods and treatments that are being developed in Cuba, not only against COVID-19, but many others. I also want to take this opportunity right after Mark spoke to say that people that are looking to get involved in Cuba Solidarity or to find out more should contact the National Network on Cuba or the Canadian Network on Cuba, and they can help you get linked in with the group that may exist locally in your city, like Mark, for example, in the new Hands Off Cuba committee that Brenda and Mark co-chair together. A reminder also to please type your questions in the questions and answers. We have 3 more speakers, and then we will go into the Q&A section. Next, we're going to be talking about another country that is in the crosshairs of the United States government at this time, and that is the country of Venezuela, which faces a US blockade and sanctions, as well as increasing threats of war at this time of COVID-19. It's my pleasure to introduce Medea Benjamin, who is the co-founder of Code Pink and an author who is well known for her work in opposing sanctions from Cuba and Venezuela to Palestine and Iran. Also someone that would normally be out on the streets nearly every day, and I'm sure is discovering many new things in this world of COVID-19. So go ahead. Well, I welcome you to this webinar, Medea Benjamin.
Thank you. It's great to be on with this wonderful panel. And when I look at you, Josefina, I think of the exciting times when you negotiated that deal and how beautiful it was to think that we were going to have a good relationship with Cuba, that things were going to change, that the embargo was going to be lifted. And now to be in this situation with facing the economic problems once again, but also this pandemic is really cruel beyond belief. And when you see what's happening in Venezuela, the cruelty is, I would say, against all of humanity. The situation in Venezuela, you still have the US having created a parallel government of Juan Guaido, and at the same time increasing its screws on the economy of Venezuela. I have just been reading a number of media reports about how awful things are in Venezuela, and they barely even mention the sanctions. They talk about Venezuela not having the oil revenue because the price of oil has plummeted, but they barely talk about the fact that Venezuela used to export its crude oil and import gasoline. And that's why there are these shortages now, because the US has tried to put the brakes on Venezuela being able to sell its crude anywhere, most recently sanctioning the Russian company Rosneft to stop it from dealing with Venezuela. And of course, the issues of Cuba and Venezuela are very connected, because the US trying to stop Venezuela from sending its oil to Cuba as well. There are also the issue of freezing Venezuela's assets. It's really like a mafia, the Trump administration stealing the government's assets overseas. Just today, the foreign minister of Venezuela talked about $342 million in Citibank in the US being now frozen. And this money is often then handed over to the, quote, parallel government. There's billions of dollars in assets, not only in the US, but also the gold assets in the UK that governments have just taken from the Venezuelan government, and then of course turn around and talk about how bad the economic situation is. Alison, when you introduced me, you added the other issue that Venezuela is facing right now, which is the threat of a military invasion. Imagine during the time when the whole world is trying to figure out how are we going to get out of this crisis, and on top of this, Venezuela has to deal with, in March, the US indicting a sitting president on bogus narco-terrorism charges and putting a bounty of $15 million on his head for information leading to his arrest. And then just weeks later, on April 1st, at a press conference to talk to the American people about coronavirus, he hijacks his own press conference to talk about the US sending this deployment of naval vessels, AWACS, thousands of sailors and Marines, the largest military deployment to Latin America since 1989, when the US went in to overthrow Noriega in Panama, and saying that this was because of narco trafficking, when it is so ridiculous to think that this kind of deployment would be for narco trafficking. It's really another threat and possible boarding of Venezuelan ships, causing an incident that would lead to an all-out war between Venezuela and the United States. So it's a very scary time. During this, Venezuela, like Cuba, is doing its best to try to deal with coronavirus. They took very quick action. 2 days after finding the first case, they announced a lockdown of the country. Also, they have experience, and like Cuba, kind of mass mobilizations that they're able to send doctors and medical students out house to house, also trying to keep up the food distribution under these very difficult economic circumstances. And then finally, there is solidarity that we are seeing from China and Russia and Cuba to help Venezuela during this very difficult time. I want to mention, I am here in Miami during my shelter at home, and to just bring in the factor of US politics, and particularly in Florida, how much of the terrible US policies toward Cuba, Venezuela, Nicaragua are a result of partisan politics in the United States, especially during an election year. And how sad it is to see both Democrats and Republicans oftentimes vying with each other to see how much they can put the screws, particularly on Venezuela right now. As Josefina said, there are growing calls all over the world to say at this moment, lift the sanctions, call for a global ceasefire. And we are excited to be part of that global movement for some sanity in international relations. And I think that in terms of the call for us on Venezuela, it certainly should be to lift the sanctions now. It also should be to unfreeze the assets and also allow Venezuela to have access to the $5 billion IMF loan that it applied for to deal with coronavirus, and that the IMF said that it couldn't give out because they didn't know who was the legitimate government of Venezuela. That's absolutely insane, and we should be pressuring our government because it's our government that is blocking that IMF loan. So thank you for letting me bring in some of the issues dealing with Venezuela, and I look forward to all working together for increasing this call to have cooperation and humane relationships during this crisis. Thank you.
Thank you so much, Medea. We thank you for being here with us this morning, afternoon, depending where you're at. Up next, we have Dr. Horace Campbell, and Dr. Horace is a professor of African American Studies and Political Science. He is from Syracuse University in New York. Mr. Horace G. Campbell is also an internationally known peace and justice activist. He holds a joint professorship in the Department of African American Studies and the Department of Political Science at Syracuse University. Professor Campbell has published widely. His most recent book is Global NATO and the Catastrophic Failure in Libya, Lessons for Africa and the Forging of African Unity. He has most recently co-authored a book on Kwame Nkrumah, excuse my pronunciation, and the liberation of Africa with Professor Michael West. Dr. Horace.
Thank you very much. I want to bring my greetings and thanks to the ambassador for the very forthright and clear statement that was made, and to all the other participants in this webinar. I want to say to the ambassador that the sacrifices that have been made by the Cuban people have not gone unnoticed. And speaking as someone within the global Pan-African movement and in the movement for peace and justice, we recognize that the sacrifices of the Cuban peoples made it possible for us collectively to transcend the evil system of apartheid. As the Cuban peoples and governments are making sacrifices with COVID, so they did in Cutco Valley in 1988, 1987, and to end the apartheid system. And I'm sure that very same international solidarity between the Cuban peoples and the peoples of peace, justice, and anti-racism will flourish out of these sacrifices. In the Caribbean, I think the national network on Cuba and the Canadian network on Cuba should bear in mind that the Caribbean movement for peace and justice has been making very clear statements to the point that they have been able to neutralize the bullying of the United States government against the governments of the Caribbean, so that even a small country such as St. Vincent or Barbados have been able to take the leadership within the CARICOM community to support the people of Cuba and Venezuela and to oppose the bullying and sanctions of the United States against the people of the Caribbean. Inside the Caribbean itself, the national movement, national network for Cuba should bear in mind that the University of the West Indies in the Africa Caribbean Political Advocacy Center has been working now with the African Union to make a very clear statement to end the blockade against Cuba. So the coming together of the Caribbean, and Africa through CARICOM under the leadership of networks in the Caribbean, progressive movements in North America are now pressuring governments all over the world to lift the blockade and sanctions against Cuba and Venezuela. In my 3 to 5 minutes, I want to say something about the interconnection between the military blockade against Cuba and Venezuela and what is going on in the United States of America. As Medea rightly pointed out, on April 1st, the United States government used the opportunity when they were supposed to be talking about this terrible pandemic against all human beings to announce to the world what the Pentagon has been doing, preparing for a military assault against the peoples of Venezuela. But we should bear in mind that this is also part of the necessity of the United States government to maintain the military management of the international system. 7 days after making this announcement, President Trump, in the briefing, spoke about the strength of the US dollar and how so many countries are now flooding their reserves in the US dollar. We have to be able, in our solidarity work, to explain to people the basis of this boast of the US president about the US dollar so that people understand the connections between the CARES Act, the Coronavirus Aid Relief and Economic Security Act. How is it possible for the United States Treasury to allocate $4 trillion for this CARES Act is definitely related to the weaponization of finance and the sanctions against peoples all over the world, peoples in Cuba, peoples in Venezuela, peoples in Iran. And when the IMF refused the $5 billion request from Venezuela, it is in line with the weaponization of finance and the way the IMF has been used by the US Treasury and by Wall Street to strengthen those forces within the United States of America that want to dominate the entire planet of the world. I think it's important in terms of our solidarity work that solidarity is not turned into something like charity, that we use this moment to educate citizens and members of the United States community about the militarization of finance by Wall Street and how it is that the US Treasury sanctions against citizens of the world is compounding this terrible crisis for humanity. I would like to end by saying that the United States of America, in withdrawing from WHO, is preparing the ground for even greater solidarity around the world to explain to people the role of the United States in WHO, the WTO, and the IMF. Just as how the United States has withdrawn from the WHO by withdrawing its support, one should understand that US pharmaceuticals have attempted to use the WHO to serve the interests of US pharmaceuticals. And we're pleased by the presentation of Ambassador Josefina to talk about the therapies that are being developed and the vaccines that are being developed by the Cuban pharmaceutical and the scientific community. And what is important is that the activists internationally pressure the United Nations so that the United Nations support lifting the blockade against Cuba and the United Nations revisit the strength of the United States in the IMF and the World Bank, where the US is able to use IMF and the World Bank for the military management of the international system. It is very crucial that in our opposition to the United States sanctions against Cuba, Venezuela, and Iran, we explain to the citizens of the United States of America how these financial sanctions support Wall Street, so that when the COVID-19 virus is used to bail out BlackRock and the financial oligarchs of Wall Street. Those are the citizens of the United States of America that should be sanctioned for compounding the crisis of working peoples, where hundreds of thousands of people are dying all over the world. The CARES Act is being used to give more money to those who are holding toxic paper based on the speculation of Wall Street. So we should not speak about the sanctions against Cuba in isolation from the military management and the way in which the Wall Street functions today. So that the call for ending sanctions must be calling for the dismantling of the Bretton Woods institution and the replacement with the International Bank for reparations and reconstruction, so we come out of this world crisis with a new international order which supports people of the world instead of supporting profits. Thank you very much.
Thank you, Dr. Horace Campbell, for your succinct presentation. I get the feeling there's a lot more you can contribute in the question and answers, and thank you for keeping it to your time very well. Next up, we have our final speaker for the panel here today. I want to welcome Fernando Perez-Viart. He is a former medical doctor from Cuba, the president of Louisiana's Cuban Club, which is an association of Cubans and descendants of Cubans living in Louisiana, and the volunteer director of Proyecto Hispano de Ayuda a la Comunidad, a Latino nonprofit in Louisiana. Go ahead, Dr. Fernando Perez-Viart. You are on mute.
Now we are.
Perfect. Thank you.
Thank you for the invitation. Thank you for all participants for the wonderful presentation, and thank you for the public for being part of this video conference that we are talking about Cuba. Talking about Cuba is talking about from my heart. After the reestablishment of the relation between U.S. and Cuba for former President Barack Obama, we established here the Louisiana Cuban Club to help in some direction the relation between two countries that is for the benefit of not just the country, it's the benefit of the people in both countries. And Louisiana and Cuba has too many things in common. Music, food, too many things. You have to be in Louisiana walking on Neolin and walking here in Lafayette to see how many things we have in common. And this is what we are doing here, promoting the Louisiana culture, the Cuban influence, the culture in Louisiana, and the relation between two countries. But now, after we notices that one important thing is the most complex situation between the two countries is the blockade against Cuba. We start doing seminar in different universities, in different school plays, to talking about Cuba and what blockade is doing to the Cuban people. What is the repercussion of blockade in the Cuban people? And now that we have a pandemic, that is a global pandemic, we notice is that besides blockade, Cuba is doing something really different compared with the United States and the rest of the countries on the globe. I'm going to show you the statistics. This statistic is taken today from the Grama, this official newspapers in Cuba. One numbers I wanted to share it with you is how many people are dying in Cuba in about a month or a little bit more of this pandemic in Cuba. It's just 31 people, excuse me. 31 people just died in Cuba. And here in Louisiana, we have about 1,200. 1,200 in just in Louisiana. This is meaning that Cuba, the medical professional in Cuba are doing something different that the rest of the world is doing so far right now. And this is how I get involved in Louisiana, sending message to different leaderships, different institutions, just to aware all of them that we have to establish some relation with Cuba and getting from them what they are doing over there and what we can implement here in Louisiana to save the lives of the people. Because the reality is people are dying with this pandemic. And right now, this is not the time for political gain. Also, it's not the time to play to be a hero. This is the time to collaborate each other, taking what is working from any place in the world and put in place to save the lives of the people. And this is why I'm joining this campaign. This is why I support this campaign from my heart. And this is why also I support the list of embargo on Cuba, because this embargo is putting people on Cuba on suffer. Principal, our friends, our family. And no reason in this kind of environment that our common enemy is the COVID-19, it's a pandemic that is killing people. The United States still keeping the sanctions on Cuba. They, 1 week ago, they posted some news that Cuba can buy food and medicine from the United States. And was a long discussion in the social media about that. And I took my time looking what really Cuba can buy from the United States, how Cuba has to buy from the United States to provide the Cuban family and save the life of the Cuban people during this pandemic in Cuba. The numbers don't lie, math not lies. Really, it's not too much what Cuban can buy from the United States to really assist the Cuban family during this time and also during the whole lifetime. Because I'm coming from the island needed a lot of resources at this moment, and a lot of resources had to be buy from across the world, and the company that has tied to the United States is doing the sanction on Cuba. No company wants to sell to Cuba because also they coming to the law into the United States, and also they not can buy anything from the United States. And everybody know the United States running the world with the dollar. And this is why I say from the heart of the United States, I'm raising my voice. I record every week a program that is raising my voice for Cuba and talking about all issues that we can, both government, the people in both sides, Cuban in both sides, sitting down the table, have the discussion and getting in a common sense that we are so close to not have a good relationship. We are so close to not establishing a relation that can benefit both countries, but at this moment has the relation that save the lives of the Cuban people and also save the life of the American people. And the best example is show what the statistic in Cuba is show to the world. Well, thank you so much for the time to listen what I had to say from Louisiana, and thank you for the people that are connecting, listen to this presentation, the video conference. Thank you.
Thank you very much, Dr. Fernando Perez-Viart. A few people have been asking questions that I think are important about the feeling of Cuban Americans or Cubans living in the United States and Canada against the blockade. So I think you helped us answering that question very well, and that will be a continued part of our work. Needs to be how can we unite people from as many communities, as many backgrounds as possible against this criminal policy, which, as you said, impacts not only people in Cuba, but people in the United States. I also want to just say that there are now over 200 people participating in this Zoom conference from across the US and Canada and also internationally. So I want to recognize there are people from other countries participating or watching live on the Facebook feed. And really the movement against the US blockade has to be an international one. We're going to go ahead and open question and answer. I will say we've gotten lots of questions, and it will not be possible for us to get to them all in this discussion period, but we will do our best to combine them and to get everyone's ideas addressed. Some of the questions will be addressed to a particular panelist, and others will be asked, Brenda or myself will ask everyone if they have comments. And then at the end, the speakers will be given the opportunity to make any final comments before we close. I want to direct the first question at Ambassador Josefina Vidal. There's been a number of questions that have been asked about the US blockade on Cuba at this time, specifically how US President Trump is always saying that humanitarian aid or medical shipments are exempted from blockades and sanctions, which we know is not the case, but could you elaborate more about the extraterritorial impact of the blockade and really how it does impact medications and humanitarian aid to Cuba as well?
Yes. So there are many aspects that I have to take into consideration to answer that question. The most important thing is that we have challenged in the last few days the US government to provide specific examples of exports of medicines that have taken place, have happened from the US to Cuba. And so far, they have been able to present one piece of evidence about this. There is a lot of manipulation about the statistics. For example, the US government considers exports to Cuba donations that in some specific moments are made by some NGOs and even by persons who send items to their families in Cuba. So these all donations count as exports from the United States to Cuba, and they attribute to themselves those figures. And so this is a distortion of the reality. If I can put you a specific example, last year, since mid-2018 till mid-2019, the Cuban main importer, the Cuban company, which is the main importer of medical supplies in Cuba, Medicuba, approached 60 American companies with specific requests of medical equipment and supply. Only 2 companies responded to the offer that was presented by the Cuban side, and both of them said that they couldn't sell anything to Cuba because of the restrictions of the US blockade on Cuba. So this is a specific information about the challenges that we face all the time whenever we want to buy some material in the United States. In 1992, the so-called Torricelli legislation that was passed in the US actually to impose more restrictions on trade to Cuba. That was the legislation, for example, that banned American subsidiaries or subsidiaries of American companies in other countries to sell to Cuba. And up to this moment, we were buying around $800 million every year from subsidiaries of US companies abroad in medicine and food. So Torricelli legislation put an end to commercial operations between Cuba and subsidiaries of US companies abroad. But because of the efforts and the demands made by many organizations in Cuba, they made an exception in that legislation for US companies to be able to sell medicines and medical equipment to Cuba. But they put so many strings, so there were so many strings attached to that, so many conditions for American companies to be able to sell to Cuba that you can count with the fingers in your hands. In 28 years, the operations that have been successful on that regard. For example, the US legislation establishes that any company which sells medicines or medical equipment to Cuba, they have to be capable of providing information all the time about who the end user of any medicament or any equipment is. And the company which would be selling those items to Cuba has to provide every quarter a report saying where the medical equipment or the medicine is being used. So in general, what is happening is that US companies decide, because of the bureaucratic red tape that they have to pass through to sell to Cuba, in general cases, in general, they decide not to do it and they reject it. I will just mention for you, the Miami Herald is a newspaper from Miami, Florida, which in general, as you know, is not a friend of Cuba. And just last week, they published an article in that newspaper, and the headline of the article is the following: US won't offer sanctions relief to Cuba amid coronavirus pandemic. So I invite everybody to read that article. It doesn't reflect exactly how we feel and how we think, but there is a lot of information that validates what I am just telling you. And that's why the US continues lying and manipulating the information about humanitarian sales of medicines and medical supplies to Cuba. Thank you so much.
Yes, thank you, Ambassador Vidal, for your very thorough response. Up next, we have a question for all of our panelists. A number of people are asking questions about Cuba's international cooperation and support against the US sanctions, especially in the time of COVID-19. Can you comment on the countries and alliances that Cuba is working with right now to build international solidarity? And can you also comment on the impact of US sanctions on Venezuela and Cuba? And once again, this is for anyone.
I think
Anyone?
one of the very important points that needs to be made as we speak, that Cuba is not operating from a position of weakness. Cuba has been able to win the moral authority to provide leadership in the non-aligned movement among oppressed peoples, so that it is the United States of America that is isolated in the international arena. I wanted to mention the case of Bolivia and what has happened with Bolivia and the removal of the Bolivian leadership and the struggles that are going on within the Organization of American States, that the United States has been working very hard in all parts of Latin America and the Caribbean to isolate those voices that are opposed to what the United States is doing in Cuba, Venezuela, and Bolivia. And the point is that the international solidarity and practical support that the Cubans have done all over Africa ensures that the largest block of votes in the General Assembly of the United Nations, coming from the African Union, supports Cuba and opposes the United States sanctions against Cuba. So the point that is at the diplomatic and moral level, the United States has lost. And that's why the United States has to do what the ambassador has said, use manipulation and dishonesty. And that manipulation and dishonesty has now reached its own people in the way they're using the CARES Act and the fraudulent ways to say that they're helping hundreds of thousands of people who are dying, but are putting the money in the hands of people in Wall Street.
If you allow me. Yes, I think it's a responsibility of all of us also in the middle of this pandemic and in the middle of the efforts that we are making, not just to cope with this pandemic in our own country, but also with our limited resources to help others as much as we can do it, to oppose the campaign that is being launched in the last few weeks in a very strong way by high-ranking government officials in the United States, that in order of, it's my opinion, to deviate attention from the mismanagement of the COVID pandemic in the United States, they are trying to attack Cuba. They're trying to discredit the wonderful and very responsible job that Cuban medical brigades have been doing for many years and more now, and has been putting even some pressures on many countries in our region and in others in order not to request any assistance or collaboration from Cuba. You know, this is just immoral. We have many evidences in Cuba because other sister nations share information with us about the pressures that the United States government has put on them in order to not to go forward with their ideas to collaborate with Cuba. But so far, you know what? The majority of the countries are not listening to the United States. I think that reality is even more is very I mean is a test, is a proof that we are there to help, and that what the United States government is trying to do is totally wrong, is totally immoral. So I think we have to oppose in a strong way these campaigns and these attacks on behalf of the United States government to prevent a collaboration, because what the world needs now is collaboration. And we have all to support the WHO, the World Health Organization, which is under attack too. And we have to defend the role of this organization, because this organization is very much involved in the worldwide efforts to coordinate and to share information about the best way to defeat this pandemic. And this is what I wanted to share.
Anyone else like to add from the panel on this question?
Well, this is Medea. Yeah, I wanted to just add to what Josefina said, how the pressure on and the change of governments in Latin America from Brazil, Ecuador, Bolivia has meant that 9,000 Cuban doctors and who were working there have been expelled. That means that people who had access to healthcare in those countries don't have access anymore, and that Cubans, the Cuban government that makes money from this program has less income. And this is a lose-lose situation for the US sabotaging of the doctor program, to call it a kind of modern day slavery and human trafficking, is just disgusting. And I think, though, that one of the silver linings of this pandemic is that people see in all its glory this Cuban doctor program. And I wish that as a result of that, there is going to be more demand, not less, for Cuban doctors. So that's one thing that's our job, is to really get out a lot of these stories of the heroic work of the Cuban doctors.
Thank you. So for the next question, it's related to this and the relationship between other countries around the world and Cuba. I'm wondering if Ambassador Vidal, someone is asking from Canada, is if there's any effort right now by the political parties or government in Canada to put pressure on President Trump to loosen the blockade against Cuba in this time of the COVID-19 health crisis.
Can you hear me now? Okay. I don't have a specific information about what political forces in Canada are doing in that regard. What I can tell you is that knowing the difficult situation that we are living through in Cuba because of the reinforcement of the blockade and the combination of the effects of the blockade with the effects of the pandemic of COVID-19, I have been in touch, and I have been sending messages and writing letters to almost all political parties in Canada, to the Canadian government too, to different organizations here, just to tell them what the situation is and to ask for their support to raise awareness about the negative impact that the combination of these two factors is having on the Cuban people and on Cuba. And this is what I am doing. I started to do that a few days ago. Actually, I saw yesterday one of the representatives of one of the party who decided to publish the actions he has been undertaking as a result of the letter that I sent, which I really very much appreciated. And we are in talks with the Canadian government. I won't say anything else, but you know, a few days ago, the Canadian government informed officially the resources that Canada will make available as the contribution of Canada to support the international efforts that international organizations and specific countries are making in order to face this pandemic. So we are reaching out to see how we can have access to some of the possibilities that are being provided for specific countries in order to be able to respond to maybe the more pressing needs that we have. So we are in the middle of that process right now. Thank you so much.
Thank you once again, Ambassador. Another question for all of you, whoever wants to answer, maybe Dr. Christine. Can any of you clarify what medication is being subject to clinical trial in Cuba? And do you have any information about clinical trials on interferon alpha 2B anywhere else in the world, such as in China or Italy?
Well, so I cannot speak. I have a feeling Ambassador Josefina could speak more to what is happening in terms of the clinical trial and other medications. What I do know is that interferon alpha 2B is like a recombinant form that was produced in Cuba's biomedical industry. So I would imagine that is part of the trials that are happening to produce the data that's going to get that certified as a treatment for COVID-19 or SARS virus 2. So with that being said, I know that Cuba is offering that medication to many countries, and I don't know who is participating in that in terms of taking that to the level of clinical trials. But again, from what I have heard anecdotally, it is an extremely important drug in terms of offering treatment options for those who have reached a more severe level, and those who are more vulnerable, like the elderly and those who are immunocompromised or have previous medical conditions. That is I think, a very clear call that many countries have made on Cuba, and they have been graciously responding to. And I think the US is also calling for that with sound reason, because it's a drug that it's interesting. I went to a lecture digitally with someone working in biomedicine in the US, and one of the questions was, why don't we have an antiviral for SARS-2, especially knowing that SARS-1 was such an issue for the world? And she was very frank. She said, we stopped investing in that research. And so I think that sadly, I'm not answering the question, but I am commending Cuba for continuing that research, understanding the important role that could play for an inevitable, we knew there was data that showed that SARS was not going to necessarily end with SARS-1. So I think it's an important drug, doing important work, and I hope Ambassador Josefina could probably answer the question better.
Yeah. Ambassador Josefina, do you have anything to add?
So this is a chart. You cannot see maybe that very well. That was published recently and presented at one of the TV programs, a Mesa Redonda Roundtable, but with the participation of all of a representation of Cuban scientists who have been supporting all the efforts in Cuba for designing the best treatment for patients with COVID. I am not an expert on this issue, but I have studied thoroughly this graphic. And according to this, there are 2 clinical trials now going on in Cuba. One with a group of people who are suspect of having the COVID. So they are not tested positive, they're suspect. And what they are using in that clinical trial, according to this information, is a molecule that which has been developed by the Center for Genetic Engineering and Biotechnology of Cuba. I don't have any more details, but I think it's a product that help increase the immune response of people who might be sick. And according to this same graphic, there is another clinical trial which is being made with patients who are in a critical and serious condition. And this is using plasma. I know that other countries are doing that too. I have read some information by Johns Hopkins University in Baltimore about this same treatment. Last week, I read that Costa Rica is doing the same. And this is the information I have about the clinical trials which are underway in Cuba now. With regard to interferon, as I said in my presentation, according to this same graphic, is being used now in Cuba as part of the treatment for patients who have been tested positive with COVID, and also with patients who are in a serious and critical condition. The graphic doesn't say that there is a clinical trial going on, but I am sure that all these treatments are being carefully followed by scientists in Cuba. in order to be able to share with the scientific community the Cuban experience using all the combination of all this combination of different treatments and medicaments in order to fight COVID while we have a vaccine available which will cure all the people who are sick. Thank you so much.
Thank you, Ambassador. Mark, would you like to add something?
Just very briefly, I think the ambassador hit the main points. Thank you for that. Our campaign is multiple aspects as I reviewed the demands or what we're calling upon, and that is available on the website. So the focus is the medical collaboration. We're also calling for expedited FDA approval of the interferon alpha 2B. We are working with physicians and institutions throughout the United States to ramp up this potential for collaboration, have folks call for the collaboration and the interferon. On a side note, I would encourage folks who did not see the PBS special Nova on Cuba's cancer vaccine, on their special program on the Roswell-Cuba collaboration, to take a look at that. That is obviously something that would be a model for the interferon studies. We are also calling on the World Health Organization, which is involved in several dozen, if not more, medicines for clinical trials, to add interferon alpha 2B to that list. There's no vaccine now, so this medicine that's been used by Cuba and reproduced in China does modify the conditions, but is not a vaccine and not a solution by itself. So the overall campaign is around, more broadly, Cuba medical collaboration with US institutions and physicians.
Thank you, Mark. Fernando, you wanted to add something as well? You're mute again.
Thank
There
you
you go.
for the opportunity. What I wanted to add to what everybody said about the Cuban drug is, so far, no country, so far, no medical institution has the treatment that can be say is the treatment to stop COVID. Everybody is trying different methodology, different drug that in some ways working good, in some ways working different aspect, but no country can move forward and say, I have the cure for COVID-19. Cuban is working in the same way, using different treatment for patients on COVID, depending on the situation and depending on the particular situation of the patient. Because as everybody knows, treatment has to be from general to specific of the patient, depending on the antecedent that the chronic illnesses that the patient have, etc. But using the interferon recombinant alpha 2 was, and I researched about that, was used not just on patients that was positive for COVID, was used in China to provide to the people, to the nurse and doctor that were working with the patient. I believe in Cuba, and I contact some doctors in Cuba, and they say they have been using in that direction. And when you see the statistic of the transmission between patient and doctors and nurse, in Cuba has the low rate of transmission between patients, doctors, and nurse, and also into the personnel that working around the patient. That is not just doctors and nurses. When you come into our country now, the United States, the transmission in that direction is so high. People, nurses, doctors, and paramedics, policemen, everybody is scared about what they can do to prevent the transmission between patients that have the COVID, that have the symptoms, that have the illness, and the people that are working with them. And we know that we have to do clinical trial, but this is the time that we first have to take in what is working, start to implement, and at the time that you start implementing, you start to clinical trial. Because between you implement the clinical trial, you're waiting for the result, you're waiting for the whole paperwork to validate the medicine, people are dying. And we can save the lives of the American people right now. Cuba has this kind of medicine that is no magic bullet, everybody knows that, but part of the old treatment that in the US is using can be working in the better way and save the lives of the American people. This is my message. Thank you.
Thank you very much. I think that's something we really want to express from the US-Cuba Normalization Committee, that our campaign today, the most important campaign we can wage, is against the criminal US blockade on Cuba, and that especially today that includes the way that it impacts medical care and healthcare for people around the world, and US-Cuba Canada medical cooperation as far as finding a treatment, a vaccine to COVID-19, and the way that lifting the blockade could dramatically impact that. I wanted to, as a final question, and ask if all panelists want to respond to this as part of their wrap up. A number of people have been commenting about how is it that Cuba, as a small country with a much smaller economy than the United States, is really able to lead the way against the COVID-19 pandemic. How are they able to show the world what it means to put healthcare and the care of humans before profit, and what we can learn from that? So for Dr. Christine, people have been wanting to know, for example, what your colleagues think when they learn about what you learned in Cuba. For the Ambassador Vidal, if you could just comment about the example of Cuba's healthcare and how Cuba puts healthcare first. And if people just have want to make any closing remarks, we'll go ahead and make this our last section before we go on to announcing upcoming events and everything. And I encourage people to please check out the chat and the Q&A, what you can see, because there's lots of good ideas and discussions happening there. So we'll go ahead and start with Ambassador Vidal, and then if any of the other speakers have a comment. Thank you. Sorry, Ambassador, you are on mute.
Okay, it's okay now.
Yes.
Thank you. Thank you so much for that question. I think it's a very good one, as you said, to wrap up. In the last few days, when we have been witnessing all the efforts that the Cuban government, the Cuban health system, the whole Cuban population have been making in order to organize as much as best as we can the whole society and all the networks that exist in the country in order to work together to defeat this pandemic. Many people in Cuba, and I know that because I am privileged to watch Cuban TV every evening, I think all the time about Fidel, and we have to recognize him for what we have today. Since the times of the Moncada, the attack on the Moncada barracks in 1953, when the program was launched by Fidel about the Cuba that he would like to see for Cubans as a result of the big revolution that our country needed, one of the first things he identified as a need for the Cuban population was to have access to universal health care, together with universal education. And that has proven to be right. So since the very beginning of the revolution, we started building a very strong health system based on prevention, with a very strong primary care level, for caring for people. And since the very beginning, we thought as healthcare as a basic and fundamental human right for the Cuban people, which is now enshrined, which has always been enshrined in the Cuban Constitution, in the new one too. But we, at the same time, we have always thought about healthcare as a right for the whole humanity. And this is what has been behind always the effort that Cuba has made since the early 60s to try to help others according to our own capacities and possibilities to confront specific health challenges. And so there is tradition, there is a long history. That was Fidel's idea too. To begin sending medical brigades to different countries in the world to help them. And so what you see now is the result of many, many, many years of this vocation that is now part of, I think, the training that all Cuban doctors, nurses, and health professionals receive when they decide that this is going to be what they do in their lives. So we have to think about Fidel, and we have to thank him because it was him. And so we are now, I think, cherishing the legacy that he left for us. And I think this is a legacy that will be there forever. So, and we are open to offer collaboration according to our possibilities to anyone. It's just a question of different governments to approach us and to tell us what they need so that we can make decisions about if we are able to provide and to respond to those needs. And this is it. And that's why we are so grateful for your support to what we are doing, not just in Cuba and not just for Cuba. We are doing that for the whole humanity. And we do that also for Canada and the United States.
Thank you, Ambassador. Would any of the other panelists like to go? Dr. Christine?
Yeah, thank you, everyone. Yeah, to close out, I would just say that what Ambassador Josefina said of in the Cuban system, healthcare being and health being a human right, I think that that is really kind of at the center of it. And I think to train within that is just this tremendous gift. And so a lot of my colleagues, like coming back, I think that they're, especially I'm interested in working in community medicine within family medicine. And so that is a system that would benefit extremely from a better preventative care, better primary care in the way that Cuba's infrastructure enables. And so it's interesting, it's like the things that we learned are just a part of the Cuban system, and they have been for a long time. And so, and then coming here, talking even through interviews, I have a lot to learn. I'm just starting out in family medicine, but it's interesting. They're like these novel concepts that are entering in our system to allow a space for uplifting communities that traditionally are not uplifted by our healthcare system. And they are just like built into the Cuban healthcare system. And so, yeah, I think that my colleagues are interested in that translating into how we can do that work in the US. And I know for a lot of my colleagues from Cuba who are from different countries, they also are excited about bringing that to their countries throughout the world. But I will also say in terms of the COVID response, I think that the Cuban people, there is a huge resilience in the Cuban people. And I will say from my own classmates and the people I learned from, there is a deep belief that health and healthcare is a human right. And it's like, that just changes the way that care is fulfilled. And also we're seeing now that it doesn't take all of these huge resources, sometimes it just takes like an ideology and putting people first in order to see positive changes for people. So yeah, so thank you everyone, and thank you to Cuba for those lessons for us all.
Thank you. Would any of the other panelists like to say anything before we wrap up for today?
It's Medea.
Go ahead, Medea.
Oh, yeah, I think the cost of healthcare per person in Cuba is about $800 a year. In the US, it's over 11,000. So we can see it's not about money, it's about political will. And it's been beautiful watching these brigades of Cubans, the ones, for example, the first one that went off to the most affected area in Italy, in Lombardy, and they were being interviewed, and the doctor said, of course we're scared. We are not heroes, what we are is revolutionary doctors. And I think there are revolutionary doctors now all over the world, including here in the United States, that are risking their lives every single day to provide our healthcare, revolutionary nurses, and that what they need is governments like the Cuban government that support them. So I hope we come out of this, at least here in the United States, with a much more robust movement for a universal single healthcare system that will provide healthcare to all of us and provide support for revolutionary healthcare workers.
Yes, this is Horace. And I want to add to what all the other panelists have said with respect to why it is necessary to intensify the work to lift the sanctions against Cuba. This, from what the ambassador said about the history of the sanctions, what we know about the history of sanctions, we know that the struggle against COVID-19, the struggle against sanctions and the blockade, the struggles against US imperialism will not be a sprint, it will be a marathon. And in this, we have to build the kind of solidarity that ensures literacy so that the peoples are not misguided with false information about the source of COVID-19 and the sources of instability in the world. The movement for solidarity must be internationalist, must be anti-racist, and must build movement of movements so that all peoples feel that the idea of healthcare for all does mean healthcare for all citizens in all parts of the world, regardless of race, religion, or sexual orientation.
Thank you, Doctor. Fernando, you'd like to say something?
Yes, thank you. I got it this time. Just say this. Many doctors, people here in the United States asking me all the time, what is the difference between doctors from Cuba and doctors in the United States? Most of the time I said, the doctors, the medicine is the same, not different. What is different and making Cuba, the medical school in Cuba, really different is the purposes of the medicine, how the Cuban apply the medicine, not just in the population in Cuba, is how they apply the medicine anywhere that they go around the world. And this is why the Cuban doctor risk their lives, go anywhere, because the spirit is save the lives of any human being. And this is the real difference. The rest is the same. The same that we study in Cuba is the same that they study here. No different. Everybody can read a medical book. You believe you are going to become a doctor? No. Doctor coming from the heart. And this is the philosophy of the Cuban School of Medicine. And this is why so far here in the United States, I still feel proud to be part of them. Thank you.
Thank you, Fernando. Mark, any final words for our final question?
No, I'm good. Thank you.
All right. So with that, I'd like to thank all of the speakers and participants. We apologize if we didn't get to your questions. I want to remind everyone that all help is welcome in this fight, and I urge you to continuously check our website for future webinars and other information on Cuba Solidarity. It's us-cubanormalization.org, and join our e-newsletter to stay in the loop.
The next webinar organized by this committee will be on May 1st to mark International Workers' Day. The exact date and time are still being decided, whether May 1st, 2nd, or 3rd. So watch your emails or contact us for more information. We'll be talking about workers in Cuba, Venezuela, and around the world, and continuing the struggle against the US blockade in the time of COVID-19. Also, everyone's welcome to join us in organizing these webinars leading up, like we said, to the November International US-Cuba Normalization Conference, which we will be hoping to have in New York City. For our final remarks, I wanted to ask Ambassador Vidal if you wouldn't mind saying a few things to close us off today, and we hope to see you all very soon.
Thank you so much. It's been a real pleasure and honor to share these 2 hours with so many friends from Canada and Cuba, some who I haven't been able to see for quite some time. Once again, I would like to convey on behalf of the Cuban Embassy, the Ministry of Foreign Affairs, the Cuban government and people, our appreciation and gratitude for everything that you do. And at the same time, I think it is important to convey a message of courage to all health professionals, everywhere they are, for the wonderful and tough job they are doing in order to keep all of us safe and healthy, because this is what is needed now. So all our support to all medical and personnel, doctors, nurses, technicians who are in the front line in Canada, in the US, in Cuba, and in every country of the world which is now affected by COVID. I hope we can stay in touch in the future to continue sharing important, interesting information about how we all are doing with this very challenging situation, and all the best for you. And please, all friends of Cuba, you all who are watching us, stay healthy and safe. Thank you so much.
Thank you, Ambassador Vidal, and thank you, everyone. We will see you again shortly. Viva Cuba.
Cuba, thank you.